be contacted and engaged in the process. And so a lot of those specifics will be further fleshed out when we start building that benefit system. The priority, and let me just back up, almost everything you hear today is in law. So while the department is in the middle of promulgating rules and regulations, timelines, premiums, local gov opt-out, that was all set by the ballot. The department has no purview in those areas. Rather, we're just charged with implementing the law as written. Next slide. Okay, so real quick, when can covered workers use family leave? Another question we're getting in is from employers, I have a very robust short-term disability plan, paid leave program in place, and we love to hear that. And while it may meet or exceed the state option, the ballot does say that a private plan must meet a handful of criteria for when a worker can take leave. So here's a list of those circumstances now: to manage their own serious health condition, care for a family member, bond with a new child, make arrangements for military deployment, and address safety needs. So we certainly do know that Colorado employers want to support and care for their workforce. And if there is a plan in place that meets or exceeds, that's fantastic. And that's, I think, was the design of the advocates of this measure. So Lydia will speak shortly about headcount and what that means in terms of your participation within FAMLI, but there are a couple of things that determine your level of participation. One is workforce size. So employers with 9 or fewer employees are only remitting the employee premium. You're not remitting both your contribution and the employee's contribution. 10 or more employees, you're remitting both. You're remitting yours and the employee's contribution. Again, self-employed and independent contractors can participate, are not required to, and that would be their contribution only. And then local governments have 3 ways they can participate in the program. So I won't spend a lot of time on that because Lydia will be going over that shortly. And then, of course, if you do have a private plan that meets or exceeds the state plan, then you are not required to remit premiums. But Lydia will go into that in a minute in terms of what that means year 1, though. There are some nuances there. So as I mentioned, again, with unemployment insurance, you may see a variation in premiums. That's because within UI, we take a snapshot of the UI trust fund on June 30th of every year to determine fund solvency and what the following year's premium rate will be. This will go through a similar process each year where the division will look at the fund balance and then determine the premium rate accordingly. However, that is fixed by law at 1.2%, and it cannot exceed 1.2% without going before the General Assembly to approve an increase. And I think I turn it over to my colleague, Lydia.
Yes, thank you, Cher. Hello, everyone. My name is Lydia, and we're going to talk a little bit about what wages are under FAMLI and some more mechanics of the program. And so let's start with the definition of wages in terms of how FAMLI premiums will be calculated. And so we're currently in the process of updating some of our rules to make FAMLI even simpler for our employer community. If you are accustomed to computing wages based off of our unemployment insurance, it's going to look very similar to you for FAMLI. And we're using the same calculations for wages subject to family premiums will be the same wages subject to the unemployment insurance. And so premiums are paid on wages up to the federal Social Security cap. And that number is not set in stone. That gets set, of course, every fall by the Social Security Administration. And so the top number for premiums will change from year to year. But again, our goal is to make the administration of FAMLI as easy and as painless for employers. And so you can find a list of payments that are considered wages on our website at the link in this deck, and then we'll drop that link in the chat as well. We also get the question of how to count employees. And so when it comes to counting how many employees you have, this is your total count, and the employer count will be calculated once a year by counting the number of employees that you have in your payroll during each of 20 or more calendar work weeks in the preceding calendar year. So in 2023, employers that report having 10 or more employees who worked 20 or more weeks in all of 2022, the employer is required to pay the employer share of the premium for all 4 quarters in 2023. Employees that are on paid leave or unpaid leave, including sick or medical leave, leaves of absence, disciplinary suspension, etc., should be counted as the employee as long as the employer expects them to return to active employment. Now we'll talk a little bit about what FAMLI is going to look like when it's up and running in 2024. And you can see a few ranges of what the premium deductions and benefit payments will look like based on an employee's wages. When taking eligible family leave, employees will receive up to 90% of their wages based on a sliding scale. Benefits are capped at $1,100 per week. This is proportional to the average weekly wage for Colorado, and this may increase over time. We do have a benefit calculator on our website to help families get a rough estimate of both their deductions and their eventual benefit payments. And again, those premiums are paid on wages up to the federal Social Security cap. So before we dive into private plans, we want to emphasize that nearly every Colorado employer will be required to provide a robust paid family medical leave program, whether they participate in a state-run family program or secure an equal or greater private plan or self-insured plan. The only employers who are not required to provide an equal or greater paid leave program are federal employers with employees in Colorado, some railroad employers, and local government employers who voted to opt out. There's a difference between the three options that employers have when it comes to private plans. And so for private plans, private employers will have the option to get their private plan approved by submitting documentation to the division that their private plan will be in place no later than January 1, 2024, and will provide equal or greater benefits than the family plan. We also have self-insured private plans as an option, and these are a subset of private plans. And these will need to follow all the same rules, the same provisions, and be approved by the division, just like other private plans. The only difference being these employers are also needed to provide a surety bond in order for the division to vet the financial standing of the company. And then local governments are the only employers who can truly opt out of the family program, and they're not required to provide an equal or greater private plan. The family statute was written to give local governments this flexibility, and this is outlined in the ballot measure. For one caveat, our private plan rules have not yet been adopted. We are very close to getting those in the rulemaking process. But in the meantime, we know employers are eager to consider their private plan options, and we're offering this temporary guidance. But of course, this is subject to change as the private plan rules are finalized and adopted. In order to qualify for an approved private plan, employers must offer a plan to all employees that provides all of the same rights, protections, and benefits as Colorado's family paid leave program. So in order to be approved, a private plan must offer at least the same number of weeks of benefits, offer at least the same level of wage replacement for each week of benefits, include no additional requirements or conditions, deduct the same amount from employee paychecks as the state plan, cover all employees through the duration of their employment, and remain compliant with any additional requirements established by the family division. We understand employers need time to shop around and consider their private plan options, and that can't happen until the private plan market opens up after we adopt the private plan rules. So therefore, we've created a temporary procedure whereby all Colorado employers will begin paying premiums in 2023. And those who secure an approved private plan effective on or before January 1, 2024, will be issued a refund of those paid 2023 premiums minus the private plan administration fee. We anticipate this private plan marketplace opening up sometime between Q1 and Q3 of next year. We will have deadlines in place for applications for private plans, which will likely be the end of October in 2023. This will all be included in the private plan rules that we are working on right now. And so probably the biggest takeaway is that, all private employers who are going to pay premiums next year while you shop for those private plans, and you'll be refunded those once the private plan is submitted and approved by the division. A little bit more about our rulemaking process. And so the rules for benefits and employee participation requirements were recently adopted at the end of August. With the benefit rules now adopted, we anticipate filing our proposed private plan rules very soon. Once filed, our proposed rules will be published on our website, and the formal public comment period will open. Notices of all of our public hearings will be posted on our rules page, and you can also read all of the currently adopted rules, the red line versions. You can listen to past hearings that we've had, and you can also submit public comments online via our comment form through the website. And so let's talk a little bit about local governments. Unlike our private employers, local governments do have a few more options when it comes to their participation in the program. And here are those 3 options. So option number 1, a local government can fully participate in FAMLI. And this option means the local government agency agrees to pay the employer share of the premium, and that's 0.45% of wages if there are 10 or more employees, and 0% of wages if there are less than 10 employees. You also agree to remit the employees half of the premium along with the wage data to the family division once a quarter. The second option for local governments is to decline all participation in FAMLI. In order to decline all participation in FAMLI, the local government body must vote to do so. The local government must then notify the family division of their vote to decline participation, and the decision to decline is good for 8 years. The local government must hold another vote if it wishes to continue opting out beyond that 8 years. And employees in this scenario would still have the option to voluntarily participate in the program, but they would be responsible for remitting 0.45% of their wages along with their wage reports to the family division every quarter. And the final option for local governments is to decline employer participation in FAMLI. So if the local government votes to decline, it still has the option to assist its employees who want to individually participate in FAMLI. And this means the local government will facilitate voluntary payroll deductions and remit the employee share of the premium and submit wage data once a quarter to the family division. I think I turn it back to Cher, and then we'll get into your questions.
Thanks, Lydia. A lot of content we have available for you on our website, some sample content you can share with your workers, an HR fact sheet, pay stub examples. Like UI, workers' comp, and wage and hour, there is a required break room posting as well. That's available online. So here's just a snapshot of everything. It is far from complete. We continue to add content and resources. We're working on an employer guide now. We're waiting on that because we need the private plan rules, as Lydia mentioned, to be adopted, because a lot of the detail we want to share with employers will come out of that private plan rule adoption. That will probably happen in a couple of, I don't know, weeks. Less than that, hopefully. I think Lydia froze on me. So anyway, here's links to resources. And then lastly, before we get to your questions, I know we have some coming in through the chat. The next slide is how to get in touch with us. So for those in the room, you've got handouts of our slides. We'll send the slide deck out after today's presentation, along with a survey. Tell us how at the end of this, you think the content was shared and presented, and what's missing that would help you in navigating this new program. So with that, Jessica, I will just let you take it away and help us get to some Q&A.
Cher and Lydia, we do have several questions coming in through Zoom, but before we do that, I just want to look around the room and see if there's any hand raised here. Look like it yet, so we'll start with Zoom so everyone here can mull over some questions that they may have. First up, Lydia, I'm wondering if you can clarify why local governments have that option to vote to opt out.
Yeah, this is a great question. And so the easiest answer we can provide is because the statute says they can. And so this was written to the statute, and some of the brief history behind that is local governments often already have access to FMLA as of course an unpaid leave, but that's not dependent on the size of local governments. And then when this was passed at the ballot, there was no funding attached for CDLE or anyone to implement this program. And of course, local governments have constraints upon their spending in particular. So the easiest answer is, as the statute tells us that this is the way that it was drafted and adopted.
Thanks, Lydia. We have a question here from Jeanette. What are the options / steps to opt out?
So that's a great question. And so I'm assuming that's for local government, because they're the ones that can opt out, or
No, I think she meant private plans, Lydia.
Oh, okay, great. That's a really important clarification. Thank you for that. So for private plans, it's not really an opt-out. It's that you will seek approval from the division to use an approved plan of your own. And so every employer registers with FAMLI, whether you're a local government or you're going with a private plan. If you're an employer, you need to register with the FAMLI division. Once you register with the FAMLI division, you can secure a private plan through either an insurance carrier and then provide us documentation that you have secured that plan through an insurance carrier. And then we would process your exemption. You can also self-insure for this. And so if you self-insure, then you would provide us with documentation of your private plan, which is really going to look like what the adopted rules are in your employee manual. And as well as a surety bond covering at least a year of premiums so that we can prove the financial solvency of the self-insurance program. So you apply and register with the FAMLI division, you apply for an exemption, and then we let you know the date that exemption is live, and we go from there.
Thanks, Lydia. Can you all still hear me on Zoom?
Yes.
Okay, cool. We just lost our screen here in the room, but we're all still connected, so we're going to keep going. I have a question here from Alexandra. She asks, she says, can you talk more about how the benefit is calculated? Specifically, she's trying to understand what earnings are included in the average weekly wage when calculating the benefit, not the premium. Is the 50% and the 90% calculated on base salary only, or are bonuses included? We pay our employees quarterly bonuses based on company and/or employee performance. Will those bonuses be included in the benefit calculation?
Yes, that's a great question. And so bonuses are wages, and bonuses are wages in several parts of existing Colorado law. And so those are included as our wages under the FAMLI rules, just like they're included under UI as wages. And so we calculate both the premiums and the benefits based off of that individual's wages. And when it comes to where they might fall in that chart, and if we want to pull up the chart, if the chart is still up in the room, that chart is based off of that individual worker's percentage of where they are with the average weekly wage. So if and it's a sliding scale meant to produce some equity for the program. So if I am a worker and I'm earning, closer to minimum wage, I'm going to get about 90% of my pay back. If I am a high wage earner, I'm going to get a lesser percent of that benefit back to me. I think it toggles down to like 34%. So those are folks that are, making a little bit more and are likely to be capped out at that $1,100 a week as well. And so we look at all of the wages, and that's why we have that link and that information in terms of like what are wages under FAMLI. And again, those wages are what are wages under UI. So we take a look at the wages, and then we take a look at the wages in comparison to the average weekly wage. And then the formula tells us kind of where you are in that percentage, but it is based off of what you are currently making. And the easiest way to get a sense of this is to go online and look at the calculator.
Thanks, Lydia. I'm going to pause for the Zoom audience for just a second and take a moment around the room. Do we have any raised hands here? Nope. Oh, go ahead, Stephanie.
I have a question and calculating here with this as I was listening. So the implementation piece, in terms of if a family member goes out on leave for up to 12 weeks, then they would be receiving this. So it's two-part. Would they have to first exhaust all of their personal leave with the employer, like vacation time or personal days? And then would the employer continue to be responsible for benefits? So if they're in a 401k plan, health insurance premiums, other benefits that tie into that, how would that work?
That's a great question. So let's talk a little bit about that. And so one, while the person's out on leave, they're getting paid from the division, not from the employer. And while they're out on leave, the employer is only responsible for keeping up their health insurance premiums while they're out on that 12-week leave. So there is that piece, you know, and then working out how you get reimbursed if you're getting you know, $0 in wages for that person. You can look at a payment plan, you can look at working with them on the back end. So that's the only piece that you're required to keep going while they're out on that leave. The other piece of the question, and please remind me because I think I lost it there.
Are they have to use all their vacation personal leave time?
Yeah, so this part is different from FMLA, and so FMLA you can totally ask the worker to exhaust those pools. The statute has a very specific provision not allowing for that practice, and so it is actually the employee's choice whether or not they want to top off their family benefits with a bank of time, and so you can't require them to exhaust any time that they may have accrued or have earned otherwise, and that's in the statute. The statute also allows for a top off, and so remember they're only getting a portion sorry of their wages, and so if you choose to allow a top off, you know, and your employee agrees to that, you can top off and then use that bank of time, but it is pretty limited on what you can require ahead of time. Excuse me.
Any other questions here in the room? Okay, we'll go back to our Zoom audience. William is asking if public schools qualify as a local government.
Yes, public schools are local gov.
Yeah. And Sandra asked, does this apply for part-time employees?
Yes, and so the family statute does not have carve-outs on part-time employees or domestic workers or ag workers or any subset or tax deduction of workers. Everybody is in.
Here's one from Terry. She's asking, are wages paid to an immediate family member, spouse / child, subject to premium?
No.
Another one from Sandra is the amount, if the amount is rollover to the next year, sorry, I'm trying to interpret this. Is the amount rolled over to the next year or does it start again?
So in terms of the amount of leave, this is on a 12-month calendar. And so it doesn't toll or accumulate. So if I have 12 weeks available to me in 2024 and I don't use it, I don't have 24 weeks available to me in 2025. It is, you know, one calendar, it is that amount of time. And the calendar is a 12-month rolling look back. And so it doesn't expand past that 12-week mark.
Yeah, Jeanette asks, can an S corp of 2 owners opt out?
So we're going to get into a little bit more on this in taxation and coordinating with our Division of Revenue. in Colorado, and we'll definitely be looking at this in the coordination of benefits section. Right now, the question is whether or not you would have to opt in versus opt out, because it's based off of do you meet the definition of employer or employee in the statute, and two owners in an S corp may not meet those definitions, but you might. You just have to look case by case.
And I think Lydia mentioned this. So the rulemaking we've completed to date, premiums, benefits, right now, again, private plans, next would be coordination of benefits. So when we started and we said we have some answers, not all, that's because some of this, which is what rules and regs are designed to do, is provide more clarity for gray areas in law. And this is one of those that we'll be addressing with the next set of rules.
I have a question here from Kathy. She's asking, as a government employer, if they decline employer participation, it appears that we could facilitate voluntary payroll deductions and remit these and submit wage data quarterly. If we decide not to withhold voluntary deductions, then is there any reporting required to the family division?
No, if you completely opt out as a local gov and you're not facilitating your employees' access to the program, then we don't need anything from you on a regular basis.
Just to clarify, Kathy, if that is the case and that is your decision, we'll just need you to register as a local government and upload your vote to opt out decision. And then once that's done, then you won't be required to do any of the further reporting.
And just to clarify what Jessica said, the system is not yet allowing for those opt-out documents to be submitted. So when we say you would register and submit those documents, that's coming with the system deployment that I mentioned previously.
We have another question here about the rolling calendar year. So Lydia, if you could clarify, is the look back for max time per actual calendar year or rolling past 12 months for each employee making a request for leave?
Sure. So it starts so that your clock starts when you access benefits, right? And so if I access benefits February 1, 2024, and I take 12 weeks, say I have a baby, right? Then I don't have 12 weeks available to me until February 1, 2025. So we look at all of that. Now, if I say you can take intermittent leave and reduce schedule leave for family, and so say I only take, say I'm on kidney dialysis and I know that I'm going to exhaust that 12 weeks because I've got to go to dialysis twice a week, right? And so I start taking my leave for dialysis February 1, 2024. I'm on it for 12 weeks. I exhaust that benefit. I don't get another day that I would be eligible for this benefit until the following February, right? Until that February 1, 2025 date. So we look back at the time that you've used, and as you can exhaust your benefit, and then you don't start accumulating benefits again to be eligible to use until that year has come up. But it's not a calendar year, it's based off of that first date of disability.
Thanks, Lydia. Another one here from Dave Golenda. He's asking, so the way the plan is currently written, there is no age limit to opt out.
Yeah, there's no age limit on there. And so it is based off of whether or not you're paying wages in Colorado and whether or not you are earning wages and paying wages that are subject to premiums. And so if I am 80 years old and working part-time at the coffee shop, then I'm earning wages in Colorado, and so I would have that benefit available to me.
Thanks, Lydia. We have two questions here about FMLA, so I'm going to combine them. They're basically asking the same thing, but if an employee uses FAMLI, can they later use FMLA in the same year? And will the employer be able to discontinue offering FMLA?
So the state division is, we can't tell you how to do your federal law, right? We can't make a law that usurps federal law or gives you a blessing to not use it, anything like that. We can't for a lot of reasons, namely the US Constitution. But you know, we are working on coordination of benefits, and it is expressly written in the statute that these two are designed to run concurrently. So will they always match up 100%? No. Will there be times when you know, you have a federal obligation where you don't have a state obligation and vice versa? Maybe. But they are designed to run concurrently, and there will be a way for an employer to make that determination whether or not someone's leave for family would also be eligible for FMLA, and then to start that FMLA clock at the same time they're on the family clock.
Thanks, Lydia. Kelly Taylor is asking, how does family affect a person who changes jobs? Say an employee takes 6 weeks of family leave from one employer and then quits, starts a new employer, and then something happens and they take family again. Do they have 12 weeks with the new employer?
Nope, it is 12 weeks total. So again, from that first date of absence, the first day of disability, then it's a 12 weeks total. And so if I had a claim with another employer, then I would have just that 6 weeks available to me with that other employer, because I've already used my other 6. And then the benefits calculation would look a little bit different, because we'd be looking at that employer's wages.
So Lydia, what if the second employer was a government agency that was not a participant in family? So 6 weeks with an employer with a private plan or state opt-in, then move to local gov with no participation.
So if you move to local gov and you have not individually opted in, then there may not be a benefit there available for you. Local gov employees, as well as self-employed employees, can opt in to family, and they can do that at any time. They can opt in, you know, right before they have a claim, which is very different from other insurance. But the way that we keep that person in the system and accountable for premiums is that they then have to stay in the program for 3 years. And they have a variety of ways to do that. If they move to another employer, that employer is paying premiums on their behalf, that counts. But they would need to stay in for those 3 years to make sure that they were made whole and paying premiums into the system. But if it's solely the local gov, they have not opted in on their own, they would not be eligible.
Thanks, Lydia. We do have one question here in the room, so go ahead. So I have a question. So when we get a new hire, we're able to look into this new system to be able to see if they used any time in the past then, correct? So that way we don't give them more time, or, you know, tell them they have more time than they actually do.
Well, the cool thing is you don't have to do that. We would do that at the division. And so it won't be something that you have to do for a new hire. That would only come up if they had a claim. And so so it's not a, hey, so-and-so's new hire, here's their information. It's, I have a claim for benefits. They make the claim to the division, and the division says, hey, this is the time you have available to you, and here's where we're calculating everything. And then we notify the employer of what that is.
Perfect. Thank you. Thanks, Lydia. And it looks like Kelly Taylor, you asked the same question about how the employer would know whether or not an employee has already taken 6 weeks with another employer. So Lydia just answered that piece of it. Cindy is asking, how is family claims communicated with the employer via email or online?
I can take that one, Jessica. So there will be a separate portal, as I mentioned, separate from unemployment insurance. So while we hope that most employers and claimants engage with us online, certainly there are circumstances where there needs to be paper communication, but generally all communication will be through the portal. From the worker perspective, they would log in as a claimant. From the employer perspective, you would log in as an employer, and the portal will be available through the division's website again later this year at family.colorado.gov. There will be a button in the middle of the page, access your employer premium account or pay premiums or create an account. So again, similar if you interact with My UI Employer, similar functionality, but generally it will be online.
We have one here from Alexandra. She's asking for an hourly employee. The benefits calculator asks for an hourly wage. But I, as the employer, need to calculate the new hourly wage that includes base hourly rate, bonus, and commission, etc.
So I mean, again, it's based off their wages, right? And so you need to put in what their wages are. And so it's not just their hourly salary, sorry. If they are earning commissions and wage and bonuses, those things count as wages and under the law. And so you would need to enter that information so we could calculate both the premium and the benefit.
And just to add on to that, Alexandra, the benefits calculator that we have on our website is just an estimate, but the portal that we've mentioned that we are creating, that's where you will put all of the wage information in and will get you an accurate. Sandra is asking, so FMLA and family runs concurrent. How does the employer calculate the amount to be paid for the employee?
You don't have to, we do that. And so you're submitting to us as the employer, the quarterly wage report, and that's the numbers that we're going to use to calculate both the premium and the benefit off of. And so you don't have to calculate the benefit. We calculate the benefit and we pay those benefits out of the state trust fund.
So not to keep going back to UI, but I know most employers are familiar with UI. So the wage reports for family will be very closely mirror the wage reports for UI with, I think, a few field exceptions. So if you have a TPA or you're submitting those wage reports to us currently, it will be generally the same process for reporting your workers and their wages. And then, as Lydia said, the system will calculate that for you. And the benefits will be paid from the department, but the employer certainly will be notified, as I said, when a claim is submitted to the division and throughout the entire benefit award process. And I'll just say there will also be an appeals branch within the division. So just again, like UI, there's an appeal opportunity, there's an integrity branch that's focused on the integrity of benefit payments. And so where we can leverage the division structure and other divisions within the department, we will. You know, the other thing to go back to is Colorado is now one of 11 states. Some states are similar. We are the only one, again, that's been passed through a ballot. Some states have local govs, not opt-out, not all of them, we do. So there are a few similarities among the paid family leave programs, but this is still a very young program nationally in its infancy. So that's why the rules and the regs and process, the public comment period, the opportunity for you as employers to weigh in and give us feedback on these rules is so critical as we're building, you know, the foundation of this program.
Okay, do you just want to take a moment to look around the room? And we've got a question from Stephanie.
Just to follow up to that with the components that you were talking about in an appeal process and so forth, would there also be a fraud component to it?
Yes, and touching on fraud just real quickly, it is a different kind of fraud, I believe, than the fraud we think of when we think UI. You know, typical UI fraud was somebody was collecting benefits while working. You know, in the workers' comp world, it was somebody collecting benefits while, you know, jet skiing or what have you. Family is a little bit different because we will require documentation. We have had a question that said, well, you know, what if my employee just goes home because their son has pink eye? You know, that would not be a circumstance, you know, generally, unless there was another underlying serious condition associated with pink eye, that you would receive this benefit. So there will be targeted audits, there will be random audits of claim integrity. Our division director comes from the absence management world, and she personally knows the process for reviewing claim eligibility. awarding benefits, denying benefits. And I think I've heard her say before, it's a lot more cumbersome to award benefits than it is to, was I saying it incorrectly? It's the burden is really on the worker to prove that they have a condition that meets one of these conditions outlined. And so yes, short answer, yes, there will be an integrity fraud unit, just like we have within unemployment insurance.
Sharon and Lydia, I'm wondering if you can speak to our communications with the TPA weekly workshop groups that we're holding. Kelsey is asking, have payroll systems like ADP indicated to the division being prepared for these items, or are employers recommended to have payroll processors set up the new tax field?
If you have a TPA, we anticipate this being fairly easy on you. We have worked with a national group of TPAs that include ADP, Paylocity, QuickBooks, some of the bigger folks. And they've done this in other states too, but we've been working with them directly with our tech team to make sure that they get what they need to set up this in their systems relatively easily. We're going to put out the API, or the little tech package that allows people that are developers to develop their own mechanism to talk to our program as well. And so that's being done with their close input. I think they meet once a week, if not bi-weekly at this point. And so I do think for TPAs, this will be a fairly seamless process.
Lydia, I'll just add, in the UI division, we have about 30 TPAs who represent close to 20,000 employers. And that does include ADP and the larger ones that are part of this stakeholder coalition. So we will reach out to those groups directly, even those who are not active participants in our weekly requirements and user feedback session, asking them what content would be useful for them to share with their clients, and how can we ensure more seamless communication with their clients.
Questions here in the room? Quick questions. So regarding short-term disability, how would it work with employers who offer short-term disability?
Yep. So the statute has a very specific clause around short-term and long-term disability, and it leaves it up to the employer to figure out how they want to address it. And so that's not something that we're going to regulate as a family division. It is our understanding that most short-term disability policies may not kick in or pay out while there's a wage replacement benefit in progress. And so that will be on your short-term disability carriers path to kind of work out with you. However, the private plans for family are being written as short-term disability policies within the state under the Division of Insurance. And so more to come on that, but that's something that you would talk to your carrier about.
Thank you. Thanks, Lydia. We have two questions here in the chat that are kind of related. Can employees use FMLA or family to supplement earnings to equal 100% of income, the top off? How will they talk to each other? Which comes first in payment if using both? And Peggy is also asking a similar question in terms of double dipping. Can employees use their sick or PTO for FMLA and then get paid for family?
So FMLA is an unpaid leave under federal law. And so if you have an existing policy that is internal to you, or is through a short-term disability policy that allows payment through that, that's great, but that's not FMLA, because FMLA is all unpaid. Family, of course, is paid. Family is capped at that 1,100. And if you choose to top off, we're assuming the top off is from a bank of time that you have set aside for that employee, whether that be their earned sick days, their vacation days, whatever that is. The statute does not allow you to say you have to use this first, but if you as the employer and your employee agree to top off and make that employee whole from getting just that 90% of their paycheck, or even that 37% of their paycheck, you can do that and do those calculations based off of what you are, what the division is paying that person, and you can coordinate those benefits with us up until their top of their paycheck. But there are provisions in the statute that don't allow someone to earn more than what they would be making if they were working. So there's windfall provisions in the statute.
Lydia, can you clarify if they were to use the top off, which comes first? The family payment come first and then top off the remainder? Correct?
Yes, and so I think by top off, families being paid out every 2 weeks, right? And so, if you're wanting to coordinate benefits that way, we would tell you what we're paying that person as a benefit, and then it would be for you as the employer to say, okay, so Joe is only being paid, $900 by family. His normal take home is $1,300. I'm going to issue Joe a check to get him up to that $1,300. I'm going to take that from his vacation time because he said that was okay to do that. So you will know what benefit that person is getting if you're coordinating benefits with them. So it's not a time wise, we just pay every 2 weeks and then we'll coordinate with you, and then you can do that on your schedule.
Thanks, Lydia. Peggy or Taryn, if we didn't get to any piece of those questions, feel free to type them in again. We do have another question here in the room, so go ahead.
So when we're topping it off, can we also top it off with Colorado paid sick leave balances? We don't have vacation available?
Yeah. I shall share unmute. So this we're working this out in coordination of benefits, and so that is earned time, and so it's earned time by hours, not necessarily earned time by level of pay. So it's not an apples to apples comparison. So the short answer is yes, and then how to do those calculations we are working out, and we're going to address those more in coordination of benefits.
Another question here in the room, go ahead.
On the topping out option for employees, they cannot double dip. So an employee can't use 40 hours. If they go over, do we have to report to the family division the hours that we're using to top them off?
No.
We don't have to report.
You don't have to report them. Right. So if you're coordinating benefits, we'll tell you how much we're paying that person.
Okay.
And then it's up to you to do that math in terms of not giving them 40 hours of a top off, but for you to figure out how much they're getting from us and how much they would get from you, and to not go over that amount. So that's not something that we do, but that would be your accounting as the employer.
So no reporting to family division.
No.
We have a question here from Kelsey. She's asking about intermittent leave request. Will the worker need to file a claim for each use, or can there be one claim that pays out for the expected usage, such as 2 hours over the next 3 months, 2 hours per week over the next 3 months?
Yeah. So for intermediate use on family, we need to know when you're taking those hours, and so it'd be on the employee to log into the system and say, I'm taking this time here, and that's done retroactively, and so they would apply for their family benefit, and that's part of the build that we're doing on benefits, and so I don't have any more information, but we do need to be able to verify that they took those hours on that day, and they're applying for benefits for that time.
But it would all be under one claim from that employee, right? The employee wouldn't have to submit a new claim every time.
Yep, correct. And so both intermittent leave and reduced schedule leave is allowed for, and that's under the same claim, and that claim runs for that length of benefit duration, which is generally going to be that 12 weeks.
We're just about at time. Looks like we're 1 minute over. Are there any other questions here in the room?
Jessica, can you launch the poll?
Sure.
We'd like to just get a sense from our participants what are you thinking about family? If you're local gov, are you leaning toward opt-out? If you're an employer, are you leaning toward private plan or state plan? I don't know if our folks in the room, Jess, you want to just poll them to get an indication of.
So for those who are private employers, by show of hands, who plans on participating in the family? 1, 2, 3, 4. And then do we have local government employers in the room? Yep. And do you plan on participating?
Has not been determined.
Are you guys both together?
Yeah.
One undecided. I'm gonna end the poll so we can see the results of our Zoom audience.
Okay. It's always different meeting to meeting. So we just like to get a sense of, is this information useful in helping you make those decisions for those who are on the fence and have not yet decided? And we also realize that the decision may be made once a private plan market comes to bear. So it's hard to make a business decision on something long-term when you don't actually know yet what the market will be. But on the other hand, we met with Weld County early on, who decided they would want to participate down the road, not now, because their plan was a bit more expensive than what the state plan was. So we hope that our content helps you in that decision-making process. But as I said along the way, if there's anything you need from us to make better informed decisions, let us know. We'll send out a survey after today's presentation, and a recording of the presentation and links to all of the content shared. So Jessica, I'll let you close this out, but I thank everybody for joining virtually and in person. Certainly appreciate the engagement, and we'll be hosting similar series toward the end of the year, likely virtual, but stay tuned for those as well.
And we do have one more question that just came in that I think we can close out quickly. When reporting wages, will the family benefits received by the employee need to be included in the quarterly wage reports? Also, will the division be sending out W-2 info to employees who have received family benefits?
Got it. So that's a great question. So again, you're reporting wages to us, not benefits. And so you won't have to include that benefits in your quarterly submission. At that time, if you're expecting that employee to come back, that's still your employee. They still count on your employee account, but you're not reporting anything to us that is not wages. And so if you're not paying them during that time, you're reporting $0 for that person while they're out on leave. And then the second part was, remind me of the second part, I'm sorry.
W-2.
W-2, yes, thank you. So for sorry, COVID is like real with the brain things, y'all. So for W-2s, you're going to report in box 14, which is kind of this miscellaneous box. And so you're going to report what you pay to your, in terms of your employee premiums in box 14. We are working with the Department of Revenue right now to get out some more specific guidance on that. And we will by the time you have to think about your W-2s for 2023, 2024. So.
All right, thanks Lydia, thanks Cher. Thank you to our Workforce Centers partners. I know we are a little bit over time and it's midday and I'm sure you guys all have busy schedules, so I'll let you get back to it. But thank you again for joining us today. Thank you for joining us online. And again, if you have questions, you have all of our contact info. So shoot us an email and we'll work to get those answered for you.
Thank you so much.
Thank you.
Thank you.